and very controversial. And I think some of you at least had the chance to join the town hall discussion that we had just dedicated to that issue, because it's a major breakthrough. It's very controversial for very good reason. And I want all of you to have at least some sense of why it's so controversial. It's a breakthrough drug in that it is the first drug approved by the FDA that may, the key word being may, have the ability to slow down the progression of Alzheimer's disease. And this is a big deal because if you've seen some of my presentations, I often will include a slide in my presentation explaining what I view as the future cure for Alzheimer's disease. And unfortunately, that cure is very unlikely to be the ability to reverse dementia once it's reached advanced stages or turn the clock back. I think that's going to be a very difficult task. But the reality is that most patients, not all, there are a lot of patients who develop symptoms, about 5% who develop Alzheimer's symptoms before the age of about 60 or 65. But most patients who develop Alzheimer's symptoms do so in their 70s and 80s. And so this is a disease that affects us in the fullness of life. We still have a lot of good years left to go, but it tends to strike later in life. And the part about Alzheimer's disease or any other degenerative brain disease that cause cognitive decline and dementia symptoms, the scary part is what things look like when people survive into later stages of disease where there is a substantial, very significant cognitive decline that really erodes the quality of life, your ability to continue to live your best life and to enjoy and have meaningful, fulfilling interactions with your friends and family and other loved ones. And that's the part of the disease that is rightfully horrifying and scary to most of us. All of us really should be. And so the promise of a drug like aducanumab that may have the ability to slow down the progression is that if we can slow that rate of decline when we go out for whatever reason, because ain't none of us on this BrainTalk Live, ain't none of us getting out of this thing alive. But if we can slow things down, even if we've developed symptoms of Alzheimer's disease, if we can slow it down so that when we get run over by that bus or whatever is going to take us out, at that point, if we're still functioning and able to enjoy a good quality of life, that to me is an effective cure if we can avoid the ravages, the horrible ravages of late stage disease. So we don't know yet, we don't have good evidence yet whether or not aducanumab will in fact do that, but there are indications that it might. And so it's a big deal. And there are other drugs in the pipeline not far behind that will likely go to the FDA seeking approval for clinical use in the next 1 to 2 to 3 years that will have similar abilities. And so it's a breakthrough drug, but we have to understand that the clinical evidence for its effectiveness is weak and very controversial. And up to 40% of individuals who are exposed to this drug could have significant side effects if their safety isn't monitored properly. So we're wrestling with the appropriateness of using the drug in which populations, which individuals would be appropriate and might most likely benefit from the drug. We have a lot of information about that. We know, for instance, that the drug should only be used in very, very early stages of disease. Patients in later stage disease will be exposed to all the risk with no anticipation of benefit. So there are a lot of issues and questions that we're wrestling through as a system. There are some questions that we can't answer because the drug's costs and other tests associated with administering the drug are very expensive. The drug itself has been sort of, priced at $56,000 a year by the company Biogen that manufactures this drug. And then there are a lot of associated costs. And so there is rightfully debate about whether Medicare or other insurers should commit such large resources to an unproven drug. And those are very legitimate concerns and questions. Nevertheless, there is enough promise in this drug that I think it still represents a major breakthrough. So that's just the most obvious indication, the clearest evidence of the progress that's being made. And so that is the result of decades of concerted research and effort to understand the disease and to develop treatments. There are many challenges ahead that we continue to tackle. One of the sort of important considerations, even with aducanumab, has to do with one of the areas that we've focused on for many years here at Emory, and that is the disparity in our understanding and disparities in access and quality access. In the studies, the two big trials of that drug, each of which had about 1,600 participants, of the subset who had the highest dose of the drug, which is the one that appears to be may be effective, a grand total of fewer than 10 in both of those studies put together. There were fewer than 10 Black patients who received that highest dose drug. So in effect, what that means is we have no evidence, no data whatsoever on either the effectiveness or potential adverse effects or side effects associated with the use of the drug. So there is this incredible lack of data on non-white populations. And here at Emory, we have, of course, I think many of you know, expended a lot of intentional time and effort and energy in engaging with our African-American community through sustained relationships in order to overcome hurdles and barriers like that lack of information, so that we know how to treat all individuals based on data, based on good scientific evidence that we collect in a careful, methodical, thoughtful way. And so we continue to do that in our center, both in terms of understanding the disease and its progression, and also being able to develop better tools to predict, stage, and direct the treatment and management of all patients, and pushing that envelope to earlier and earlier stage patients so that we can identify individuals at a stage where disease may be present inside the brain, pathology and changes of Alzheimer's may be present inside the brain, but there haven't been any symptoms yet. And as in all medical conditions, we are going to be much better off and more effective if we can prevent disease rather than chasing our tail and trying to treat disease after the disease has already kind of settled in.
So, Dr. Law, on that note, can I interrupt you here?
I was going to shut up and let you talk.
Well, one of the things that we promote, Dr. Law has done a great job explaining this medication and how important it is for the future development of Alzheimer's. But one of the ways that any of us on this call can be sure that we're counted in the discussions that follow is to become an active participant in clinical research. No, it's not guinea pig research. So we have several different things that you can participate in, several different studies where we do what we do to evaluate people with cognitive problems or memory loss problems. There are studies that we have here that conduct and give you an MRI. There are studies that we conduct here that involve what we call a PET scan, which is the only FDA-approved neuroimaging study that actually diagnoses Alzheimer's disease. And one of the requirements for being put on Aduhelm is that you have a PET scan positive study that shows that you actually have the risk factors or the biomarkers on PET scan that show that you have Alzheimer's.
Or spinal fluid, or spinal.
Yeah, or spinal fluid. But the other thing, and this is the part, and I'm going to turn this back to Dr. Law since I've interrupted him, is to talk about our observational studies or our surveillance of people who are healthy, like most of us on this call, we look healthy, but we don't know what's going on behind the skull. Can you talk a little bit about our Emory Healthy Brain Study, our longitudinal brain studies, biomarker studies that we're doing here?
Absolutely. So Dr. Parker is integral to the recruitment and retention and education for our Alzheimer's Center, and also for the Emory Healthy Brain Study. And the Alzheimer's Center, we enroll individuals, mostly older individuals, both the individuals who are cognitively normal, not experiencing any symptoms, but also enrolling individuals who may have early stage symptoms of memory loss, mild cognitive impairment, early cognitive loss. And we do that in a longitudinal fashion, following those individuals, both the cognitively normal and mildly impaired individuals, to try and understand the course and the development and the initial emergence of those symptoms. And in the Alzheimer's Center and also in the Healthy Brain Study, what we're doing is we're asking our volunteers to not only come and be seen annually, but also every 2 years to undergo a brain MRI scan, donate blood, and donate spinal fluid for those who are eligible to do so. And the reason we're doing that is because we need to develop better tests, preferably transition these tests from spinal fluid to blood. And so we're actively working on identifying markers in the spinal fluid that can be translated to detection of markers in blood that will tell us something about what's going on inside the brain. And the Emory Healthy Brain Study is similar in many ways, with one major difference. And that is, we know that Alzheimer's disease as a pathological condition, so there's often a lot of confusion about, when I say Alzheimer's disease, do I mean somebody who's already got symptoms of dementia or memory loss? And really, in this context, what I'm talking about is Alzheimer's disease in its entirety. So Alzheimer's disease, we know, is characterized by certain changes that occur inside the brain. The two best known hallmarks are something called amyloid plaques and neurofibrillary tangles. Those two pathologies, which are not normal findings in the brain, are present in every individual who has Alzheimer's disease. But for up to 20 years, those pathologies may be present in the brain without causing any symptoms. And that's what we think happens, is that by the time somebody has developed symptoms of memory loss or other symptoms associated with Alzheimer's disease, we think that the changes of Alzheimer's disease inside the brain has been there and brewing and causing injury over a period of 20 years. And so if we want to effectively target efforts to predict and prevent disease, what we need to do is we need to understand that disease process during that 20-year period of silent evolution of pathology. So kind of like, when you have, I don't know how many of you may have had those calcium imaging scans of your heart, but ways to evaluate the development of blockages of coronary arteries in the heart. We do that in order to assess the risk of somebody having a heart attack, because we don't want to wait until they've killed a piece of their heart from a heart attack to intervene to reduce their risk of having a heart attack. And by the same token, what we want to do is we want to be able to detect the presence of Alzheimer's pathology in the brain during that 20-year silent period. And we already have some methods that we can use to do that. But we also want to be able to say, okay, we think that this individual is developing Alzheimer's disease, early changes inside the brain. Now, I need to know, is that person ever going to develop symptoms in her lifetime, in his lifetime, symptoms related to those changes in the brain? And if they're going to develop symptoms during their lifetime, when is that going to happen? Is that going to happen tomorrow? Is that going to happen in a year? Is that going to happen in 5 years? Is that going to happen in 10 years? Is that going to happen in 20 years? Because being able to predict that will tell us who needs to be treated and how aggressively at what point. And so the Emory Healthy Brain Study has so far enrolled about 1,400 individuals between the ages of 50 and 75, so much younger population. And just like in our Alzheimer's Center longitudinal cohort, these incredible volunteers agreed to come every 2 years, have a brain MRI scan, have detailed cognitive testing, which is the part that drives people crazy, donate lots of blood, and have spinal taps to donate spinal fluid. And they do this every 2 years. And by doing that, we can follow these individuals over time, and what Dr. Parker alluded to as an observational study, because we're not doing anything to intervene because we don't know yet what to do to intervene, but to observe the changes and to detect changes and develop tools to specifically identify those changes so that we can reach that end goal of being able to say, okay, Jim, you're now 65 years old, and you have evidence of Alzheimer's pathology in your brain, but I've got good news. These tools that we've developed tell us that you're not going to develop Alzheimer's symptoms during your lifetime. Or, sorry, Jim, you're 65 years old and you have evidence of this Alzheimer's pathology, and it looks like you're probably going to develop symptoms in about 10 years. If we can do that, the development of treatments is going to progress over the coming years. If we can do that part effectively, that prediction, then what we can do is take advantage of the emerging treatments and say, okay, we know you're going to get in trouble in a few years. We're going to start this treatment now so that you don't develop symptoms in 5 years, you develop symptoms in 10 years or in 15 years or in 20 years. And the more we push that envelope, the more we're going to be at a point where we can completely prevent the development of Alzheimer's disease. And that's the end goal. And I fully expect to see that in the course of my career. So that's what we're headed to. And that's really the major thrust of a lot of the research that we're doing in the Alzheimer's Center, the Emory Healthy Brain Study. Dr. Hajar has another cohort called the vascular cohort, which is another observational cohort. But we've harmonized all of these large cohorts, large diverse cohorts. The Healthy Brain Study right now is not very diverse. It's got about 83, 85% Caucasians. And so during the next funding period, Dr. Parker and others are helping us to try and improve our strategies to increase the diversity of that cohort, because I want at least 1,000 of the total 3,000 that we expect to enroll in the Healthy Brain Study to be African American, so that we can draw conclusions that are broadly applicable.
And not just African Americans, for everybody who's worried about it. I like to think of us as different ice cream flavors. We don't want just plain vanilla. We don't want plain chocolate. We want a little Rocky Road, sometimes some sherbet, some sorbet, something a little different.
We're not excluding anybody. I know Dr. Parker's always sensitive about that. In fact, it always embarrasses me a little bit because there's a huge Korean American community in Metro Atlanta, and it's always kind of embarrassing because even though my cultural heritage is Korean, I speak Korean very poorly, and I'm always kind of embarrassed when I'm interacting with that community. And so we want to build bridges into the Asian American community, into the Hispanic and our Latinx communities. But because we're in Atlanta, and because Dr. Parker has championed our engagement with the African American community, and we're in Atlanta. I mean, this is the home of Martin Luther King. This is arguably the capital for historical civil rights and African American culture. And so, and plus there are unique demographic advantages in Atlanta based on the high level of education and a very stable, affluent middle class of African Americans who are in a better position to participate in research. And so we focus very specifically on the African American community, but we realize that this is a challenge that confronts all communities and all people of color, as Dr. Parker has gotten me accustomed to saying, even though I still don't really like the terminology, but all individuals. We want our work to be applicable to every human being.
Thank you, Dr. Lon. While you're at it, and I'm going to let you go do your paperwork, there are a couple of questions, and one of those is, if a person turns 75 while in the study, would a person be dropped from the study? And this is like the different studies, aside from Emory Healthy Aging, we have memory. Can you talk about that, please?
No, we don't age people out. So we haven't sort of implemented, but this in the Emory Healthy Brain Study, but we will. In the Emory ADRC cohort, everybody that's enrolled in that in the ADRC, we asked them to consider donating their brains after death. And we're going to do the same with the Emory Healthy Brain Study. The boundaries, we want to keep these groups sort of separate in that we want the volunteers in that group to be able to specifically identify themselves as being part of the ADRC cohort or vascular or the Healthy Brain Study. And that's really just so to avoid sowing confusion among our volunteers. As a research community here, Dr. Parker, Hajar, Levy, all of us kind of have made an effort to make all of those groups as similar as possible in terms of the evaluations, the biospecimens, and everything else, so we can actually combine forces. And in all of those groups, we intend to continue to follow people indefinitely to the time of their death. And if they're willing to actually ask that they donate their brains after they die, and the value of those brains, especially after longitudinal follow-up and a lot of data collection, is immense. Especially for cognitively normal brains. We have hundreds and hundreds of brains that have been donated by families after their loved ones have passed, loved ones who suffered from Alzheimer's or other diseases. But what we don't have is we don't have a lot of brains from people who are able to age successfully to the point of death without any cognitive decline or memory loss. And we need to know what normal looks like. We need to know what resiliency, what allows one person to remain cognitively normal to advanced age, and how can we learn from that in order to better prevent and treat the diseases associated with aging.
Well, I think that's a good answer, Jim, and that's excellent, because one of the things that we want to do, we have other studies that are here that study exercise, that study how people age and why people who are super agers are super agers. Dr. Trammell has that study. There are studies on hormones. There are studies on saliva, eye movements, stool. You know, what you eat makes a difference. We've been talking a lot about exercise because we stress the things that are preventable. 30% of all global dementia is preventable by lifestyle change. And that includes exercise, that includes changing your diet, that includes things like sleep. So we have a lot of researchers here who are engaged in different kinds of research. And if you call Ms. Chung or Ms. Crystal Davis, who is one of our coordinators, they can point you in the direction of the proper study. We have an Alzheimer's disease neuroimaging study where we need people to get pictures of their brain, those PET scans that we talked about. This research is free of charge, but more importantly for you as a research participant, you become a lot more savvy about how to take care of yourself, what to look for when somebody looks like they're starting to have trouble with their memory. And I say memory because brain dysfunction encompasses other symptoms besides memory loss. Overall, we like to make sure that you engage the services and partnership with a good primary care doctor. You can seek those services here at Emory through our Emory Primary Care Network or Emory Geriatrics, but any provider within the state of Georgia who has geriatric knowledge and knowledge of Alzheimer's and related dementias is going to be somebody you need to get to. So I think there are a couple of questions in the chat. We've got 8 more minutes. Ms. Joyce Pelfrey has said that I went in for a study. They said it was done every 3 years. I need to help you understand that different studies have different requirements. Our memory study, that's the Alzheimer's disease study that we're doing in cooperation with the 31 other Alzheimer's disease research centers. Those people come in every other year. For Dr.
They come in every year, but the MRI and spinal fluid is done every other year.
Okay, thank you. The study that Dr. Hajar is doing with metformin, a diabetes medicine, maybe every couple of months, every year, you have different visits. Different studies have different requirements for what you need to have done at what time. And the thing that you need to do is to ask what is required of you. Some studies last for a year. Our observational longitudinal studies like the Emory Healthy Brain Study or the memory study or the Alzheimer's disease neuroimaging study are studies that you participate in as long as you're able to do so. Some studies require you to have a partner. Some studies don't require that at all. In any event, we want you to participate in our research. Our online Emory Healthy Aging study just is a questionnaire. You can do that online. If you want to go further, you can. All research is voluntary. You're not required to do anything. If you are a candidate for a drug trial, and people get confused about this, you have to have a diagnosis of Alzheimer's or related dementia to be in any of our drug trials. That means that you have had a thorough evaluation with pen and paper neuropsych testing, you've had a brain image, you've got lumbar puncture, so we have cerebrospinal fluid. People who need to be in a drug trial can't just come in off the street. We have to have documentation that this is truly what you have. Through research, we get an evaluation, but research is not an excuse for you not to see a doctor and get a full medical evaluation. In fact, we discourage that. So we want you, if you're healthy and you don't think there's anything wrong with you, that's the best person to be in any of our research. But if you're under the care of a neurologist and you've been diagnosed with Alzheimer's, there may be a drug trial for you. All treatments for Alzheimer's are not treatments for the other dementias like Parkinson's dementia, HIV dementia, vascular dementia. Different types of dementia have different causes and they subsequently have different treatments. So Aduhelm is not going to be the proper treatment for somebody who's had a stroke and has developed vascular dementia. I see some questions in the chat, and Cornelya, I'll turn it over to you at this point.
Okay, well, thank you all. With one closing thought, because 25% of our audience, they are what we call, or who Dr. Law referred to as the free-range elderly, is that correct? So they want to stay healthy. And so what can we tell them to do as our final closing thoughts? As an aging adult, what can you do to reduce your risk?
So Dr. Parker alluded to the fact that we think that 30%, maybe even 40% of all worldwide cases of dementia from all causes, not just Alzheimer's, but other causes, can be prevented with lifestyle changes. So the thing that we tell everybody to do, starting from as young an age as possible, is to eat right, meaning eat a good heart healthy Mediterranean type of diet, lots of fresh vegetables and fruits and nuts and whole grains, and avoiding highly processed sugars and fats and highly processed foods. Take the Twinkies right off of your regular diet. And then aerobic fitness turns out to be incredibly important. And so we encourage everybody to get at least 30 minutes, 5 days a week of moderate aerobic exercise. You can do more intensive aerobic exercise. There's some scary research that may be pointing to the fact that the most effective aerobic exercise may be interval training. And those of you who may have been subjected to interval training when you were, very athletic, I don't think I could survive interval training today. So diet and exercise are very important. But the thing that I've gotten really, really much more convinced and really impressed by is the evidence of importance of mental and social engagement, especially engaging long-term in activities that continue to provide you with a sense of purpose and engagement. And so those activities, those people who either continue to work in an occupation that they love or engage in avocational interests or ministries that provide a great sense of engagement and continued sense of contribution and purpose, that really appears to be incredibly important. That level of mental and social engagement with those around you appears to be incredibly important at supporting your brain's resiliency, your brain's ability to resist the effects of age and disease. And so, if you, I personally don't ever intend to retire, but if you do retire or you are retired, make sure you're not, letting things just kind of sit. Find things that continue to give you stimulation mentally. Find things that continue to connect you with other people, and find things and activities that continue to provide you with a sense that you're contributing and have a continued strong sense of purpose in life. And that's something that I think all of us should be doing. It makes for better health, better brain health, and really a better society. So there are really no downsides and a lot of upsides to doing each of those things.
Thank you, Dr. Locke. Cornelia, turn it to you.
Okay, well, this concludes our Tuesday. Thank you again, everyone who called in, dialed in, you're listening in. This recording will be available for you to view next week. Such amazing insight and guidance provided by our faculty today. And a final thought, as you know, if you are a returning guest, every Tuesday immediately following BrainTalk Live, our Cognitive Empowerment Program, or CEP, has their own program at 3 o'clock. And so today, I believe they're going to be featuring their Tai Chi instructor. So we talked about exercise, we talked about getting physically active, even if it's not vigorous, you still need to be active. So Matt, tell us who's coming on for CEP today at 3, and please share that link with us.
Hey everyone. So today for CP Community Live, we're joined by Tina. She is our great Tai Chi instructor, and she'll be doing a Tai Chi workout with us. So if you want to get that blood pumping a little bit more and do another workout, please come see us.
Wonderful. Okay, so Matt's going to post the link. It is a separate link for our newcomers. The link for our BrainTalk Live. If you are registered for that link, you are good for the rest of the year. Please share that link with your colleagues, your friends, your family members, or whomever. We will continue to host these weekly sessions on Tuesday virtually until further notice. All right, I see lots of kudos and thank yous to Dr. Law. So again, we appreciate him for coming on. Take this moment to grab the link for CEP, okay? They're getting ready to start, so you can grab that link. Okay, what is the link for? Yep, they just posted that. So Matt or Crystal, you might have to post it a few times for people who aren't able to see it as the chat comments continue to come up. If you will do that, we really, really appreciate it. All right, thank you all. Thanks for this session, very informative. Thank you for the information. Thank you guys. We appreciate all of your comments, your feedback. We take that into consideration. So we appreciate all your positive feedback and constructive criticism as well. Last week, someone said, take longer when we are posting telephone numbers and websites. So if you see us kind of belaboring a point, we want to be patient with all of you to make sure everyone's getting all the information they can, especially while we're live. Okay, so we're just going to keep posting that link to make sure you can grab it. If you have any problems, just send us a chat or a Q&A. And thank you. And thank you again. We appreciate you. Every Tuesday, we've been doing this. Bye, Dr. Law. We will see you hopefully again with a pop-up session. That's how now we know how to get you on the line. We just tell everybody you're coming on. All right. Have a good rest of the week. Okay. I see Miss Lori. Yes, thank you for the session. See you next week. Yes, we want to see you guys back here next week, every week. It's always a different topic, but the format is typically the same, where we kick off with exercise and we try to answer your questions live as you post them, depending on who is being featured. And every week it's a different topic. So sometimes we know who's coming on ahead of time, and sometimes that changes right before we go live. So we don't always know who's going to be here. Again, Dr. Law usually has clinic. He's seeing patients at this time, but that wasn't the case this week. So, all right. Thank you, Miss Arlene. Thank you, Miss Mary, Thomas. Ms. Patterson, Letha, thank you guys. All right, if there is nothing else, we will turn it over to you all to transition to the next Zoom session. Remember, all of this is great for your for neuroprotection, engaging socially and through these educational channels. So you can't get enough. Okay, needed for your DRPH. Great, awesome. That's great to hear. Okay, so if you've got the CEP live link, head over there and we will see you back here next Tuesday at 2 p.m. Thank you for joining us.